All right, hello everyone. Happy Friday and happy last Friday of May. It's almost the summer, so welcome everyone. Thanks for joining us today for Grand Rounds. My name is Jed Thompson. I am the Associate Director of Communications here at this Department of Psychiatry and Behavioral Sciences, so welcome. Before we begin today, I do want to cover some of our logistics, talk a little bit about our Grand Rounds series, and of course, give people a little bit of time to arrive and log into our Zoom presentation. I'm going to start by addressing our most frequently asked question, which is, are we recording this presentation? And the answer is yes, we are. We're recording this, and we will be posting it in our Grand Rounds archive at some point next week. So if you want to watch it again, or if you want to share it with someone who you think will be really interested, go to our website, just type in Grand Rounds into the search. You'll find a link there that leads us to our archive on YouTube. Okay, also, if you want to give us any feedback after the presentation, we do have an evaluation form. That survey is in a link that you'll see as the webinar closes. So that'll be available after the presentation. I believe it's also in the email. If you receive our emails every week saying who the presenter is, the same link will be found in that email. So love to hear from you there. Okay, for today's presentation, we will possibly have a little bit of time for questions at the end. So if you think of a question at any point during the talk, just go ahead, type it into that Q&A feature. I'll get those queued up, and I'll come back at the end if we have some time and read those questions and get those answered for you. Also want to let you know that next week will be our final Grand Rounds presentation from the 2025-2026 series. And that will be we'll have actually a number of guests who have participated in our clinician scientist training program. So they'll be joining us to talk about their presentations, or sorry, their projects. And I believe Dr. Jesse Fan, who's the director of the program, will be here as well. So please join us next week for our final presentation. All right, so let's talk about this week. If we want to go to the next slide here, it is my pleasure today to introduce you to Dr. Jennifer Peel. Dr. Peel is one of our faculty members here in the Department of Psychiatry and Behavioral Sciences. She's an associate professor, and she's also the staff psychiatrist at the VA Puget Sound and the director of the UW Center for Mental Health Policy and the Law. She holds multiple board certifications in psychiatry, forensic psychiatry, brain injury medicine, and sports and performance psychiatry. So she's a unique faculty member because in addition to her medical training, she also received a law degree from the University of Washington. And as a member of the American Academy of Psychiatry and the Law, she serves on the Ethics Research and Resident Education Committees, and she twice earned the Academy's Young Investigator Award. And she's received many additional awards and honors, including most recently our department's Gary J. Tucker Significant Achievement in Education Award, and the 2026 Award for Creativity in Psychiatry Education from the American College of Psychiatrists. Dr. Peel teaches courses in forensic mental health at UW, and she speaks locally and nationally on topics related to psychiatry and the law. And that is why she's joining us here today. So I think with that, I will disappear for a while and I'm going to turn it over to you. Thank you for being here today, Dr. Peel.
Wonderful. Thank you so much for that very kind
Of course.
introduction. As was just mentioned, I am Jennifer Peel, and I'm the director of the UW's Center for Mental Health Policy and the Law. Today, I'm going to be talking about how forensic mental health connects clinical care, legal systems, and policy. And I really hope to convey that having an understanding of and training in forensic mental health can strengthen care across systems. So now I'll be sharing some of the work from the Center for Mental Health Policy and the Law, but I want to make sure that you recognize that the center would not be possible without the core faculty, the staff, the contributors, trainees, and collaborators. Our work is fueled by the collective dedication of our team and the belief that this work is important. You may know we have a small team. It's a small team of core faculty consisting of Dr. Sarah Kopelovich, Dr. Kate Michelson, and myself. And we have two staff that are instrumental in keeping us on task and also helping us to move forensic programming forward. And those staff are Susan Reynolds and Selena Adler. All of the core faculty and staff are part-time with our center, so we really value the input and participation of all of those who have helped us move forward with forensic mental health programming. The Center for Mental Health Policy and the Law has reached its 5-year mark. So it's really a nice time for me to be here today and highlight some of the work of the center, highlight some of the center's faculty and staff accomplishments. I'm going to tell you more about the Center for Mental Health Policy and the Law in the course of this talk, and I hope to highlight some of the center's accomplishments. But, despite our limited people power and our relatively short existence as a center, we are establishing ourselves as a trusted hub for research, for education, and for policy innovation. And we really dedicate this to, assisting individuals with behavioral health needs who may be involved in various aspects of the legal system. Some of our primary goals is really to do this through empirical research, education and training, and policy innovation and community engagement. So in our time together today, I hope to cover 3 things. 1, the scope of forensic mental health. And I'm actually going to focus most of my time on that area. We're also going to talk about the mission and activities of the Center for Mental Health Policy and the Law. And then finally, we'll conclude with some future directions with a focus on collaborative approaches to improve justice and mental health outcomes. I have no relevant financial relationships to disclose. Okay, so let's start by talking about the scope of forensic mental health. Now, the lay public is much more likely to have encountered a forensic psychiatrist on television or in the media than they've likely been to have encountered one in real life. So similarly, in the courtroom, a jury's perceptions and expectations of forensic psychiatrists or other forensic mental health clinicians may be formed by these depictions. And in fact, this may be true for you too. Hollywood often portrays forensic psychiatrists as criminal profilers or courtroom dramatists, and the media tends to focus on expert testimony and the battle of the experts. But forensic psychiatry, forensic mental health, it spans clinical care, evaluation, policy, and systems level work, and actually much more. In reality, the field is broad. So what is forensic psychiatry? Well, forensic psychiatry is a subspecialty of psychiatry that focuses on the intersection of mental health and the law. Forensic psychiatrists apply psychiatric expertise to legal questions. So we work with courts, attorneys, hospitals, and justice-involved individuals. I'm spending some time on the definition of forensic psychiatry because understanding the breadth of forensic mental health is 1, essential for training in forensics, and 2, it illustrates, I think, the scope of activities and expertise that can fall under the UW's Center for Mental Health Policy and the Law. Written here is the definition of forensic psychiatry from the American Academy of Forensic Psychiatry, known as AAPL. And AAPL is the professional organization for forensic psychiatrists. So Apple defines forensic psychiatry like this. Forensic psychiatry is a subspecialty in which scientific and clinical expertise is applied in legal contexts involving civil, criminal, corrections, regulatory, or legislative matters, and it's specialized clinical consultation in areas such as risk assessment or employment. So it's a field defined by context, not diagnosis. And definitions for forensic psychology and other areas of forensic mental health are similar. Roles in forensic psychiatry. So forensic psychiatrists work across multiple domains. Treatment, particularly in high security settings like carceral settings or state hospitals. We do evaluations, not only in the criminal legal system, but in civil courts and in administrative proceedings. Many forensic psychiatrists are involved in administration, with their background in law and systems of care. Many individuals who have trained in forensics take leadership positions and administrative staff positions. Others are involved in research and policy, and then teaching and training. Across all of these, we bridge mental health and the law. Here's the landscape that we operate in. And some of this was alluded to, I think, in the Apple definition of forensic psychiatry. But I think it's helpful to flesh out some examples of each context. So we work in the criminal context, the civil context, and within the legal regulation of psychiatry or mental health. Some examples in the criminal context include things like evaluations for criminal competencies, like competence to stand trial, or competence to plea, or even competence to be executed if you live in a state where the death penalty exists. We participate in types of evaluations for mental state at the time of an offense, for insanity evaluations, and things like sentencing considerations. In the civil context, we're often involved in civil commitment, civil capacities like capacity to make medical decisions, or other civil capacities like testamentary capacity, guardianships, disability determinations, malpractice, and personal injury litigation. So for example, let's say someone claims psychological harm after they've been in a motor vehicle accident. A forensic mental health expert might evaluate the legitimacy of those psychological symptoms and whether they in fact were attributed to the claimed injury. And then finally, the regulatory sections. So here we think of things like confidentiality, right to treatment, right to refuse treatment, professional licensure, and telehealth regulation. So these legal frameworks not only are relevant to the criminal legal system, but really to everyday psychiatric practice. I'm going to share next some experiences regarding our own psychiatry trainees here at the University of Washington. So understanding the breadth and the range of topics and practice settings in forensic psychiatry is really essential for preparing learners to work effectively at the intersection of mental health and the law. And working in a university setting, it is also very important for us to identify gaps in current training. By mapping the scope of the field and areas where learners seek more exposure, we hope that we, and working with others, can design and promote targeted learning experiences that strengthen the clinical, legal, and ethical competencies of our learners, really to ensure that they are better equipped to respond to challenges at the intersection of mental health and the law. So we surveyed psychiatry learners here at the university really to understand their exposure to forensic topics while in the psychiatry training programs at the University of Washington. The respondents spanned all 4 PGY years and a handful too from the PGY year. So it gave us a broad view of some training experiences. It is important to note the distribution of respondents in this survey study. In fact, the training curriculum has generally offered more didactics in forensic psychiatry for learners in their third and fourth years of psychiatry training. And although I would argue that all clinical rotations have opportunities for learning related to forensic mental health, the majority of elective rotations with forensic psychiatry as a focus really have been for third and fourth year trainees, at least historically. So we asked our learners, what topics come to mind when you think of the term forensic psychiatry, when you see that term or hear that term? And when residents hear the term forensic psychiatry, they think really of four main areas as reflected in this study. We asked them this open-ended question and then did a thematic analysis. And this is what we learned. The number one theme that emerged was the criminal justice system. That's what they thought of when they thought of the term forensic psychiatry. This includes things like the courts, trials, criminal charges, and sentencing. The second most popular theme was correctional and forensic settings. So things like jails, prisons, forensic units in a state hospital, and competency restoration programs. The next was competency and other types of legal evaluations for the courts. And examples that we got there were competency to stand trial, other evaluations for the criminal court, and then we had a handful of comments about disability evaluations, the civil evaluations. And then finally, we heard court involvement and expert roles. So things like being an expert witness and testifying in court, report writing for the courts, and working with attorneys. So I think these responses here are instructive. Without further direction, you can see that the themes focused on aspects of criminal forensic psychiatry and court involvement. Now, in the survey, we actually provided the respondents with a definition of forensic psychiatry and then provided some examples. We then asked them about their exposure to forensics. And based on the survey results, psychiatry residents' exposure to forensic topics, settings, and experiences really varied significantly. So let's turn to each of the columns here. That left column, high exposure. These are topics or processes that more than 80% of the respondents indicated that they had meaningful exposure. So some examples here include general legal concepts, like knowing the difference between civil law or criminal law, recognizing sources of law, identifying resources to learn about the law. Other high exposure areas include self-harm and suicide risk assessment, violence risk assessment, and the mental health clinician's duty to protect persons from violent acts of their patients, civil commitment, the criteria and process, civil competencies, mainly capacity to make medical decisions, but others as well, like consent to research or capacity to manage finances, and then malingering of psychiatric symptoms or conditions. Now, to me, these reflect exposure to core clinical forensic topics and skills. Let's look next at that middle column, moderate exposure. And this is where approximately 61 to 81% or 80% of our respondents said they had meaningful exposure. Examples here include professional liability and risk management, legal regulation of medical or psychiatric practice, so things like informed consent, confidentiality, licensure, telehealth regulations and liability considerations within telehealth, taking a criminal legal history, and observation or direct participation in court testimony. So with this category, exposure varied by resident participation in elective rotations, in extracurricular activities, and exposure really to faculty expertise. And then turning to that final category on the right hand there, this is where there's reports of more limited exposure. So less than 50% said they had meaningful exposure at the time they completed the survey. Topics here include, having discussions with patients about disability paperwork and actually completing different types of disability evaluations. Familiarity with competency stand trial assessments and restoration services. Familiarity with mental state or insanity evaluations for criminal defendants. And forensic topics for special populations, such as minors, the elderly, or persons with intellectual disability. So these low exposure areas represent or have represented true training gaps for most residents in our program. Supervision of faculty or by faculty. We also asked our residents, are your faculty supervisors familiar with forensic topics common to their practice setting? And when we asked this, we essentially found that only 28% of the residents surveyed reported that supervisors were familiar with forensic topics relevant to their setting. Half were unsure. Now, this perception does not imply that faculty lack competence in these areas. Instead, it is likely that forensic topics are not specifically identified, not specifically named as forensics, and then discussed within supervision. Faculty are likely applying forensic principles in their work, but making these thought processes explicit could really help residents better recognize forensic topics and then learn from them. So this highlights an area for faculty development. We also asked the residents an open-ended question about training or experiences they would find useful. And, I fully expected to see topics and experiences related to criminal forensic psychiatry based on their initial responses in our survey. But what we learned was this: residents want more clinical forensic skills integrated into routine care. And in fact, this was the most common theme. We also learned that they want more exposure to forensic settings, things like correctional settings and state forensic units. More structured didactics or dedicated lectures with forensic themes. More guidance on malpractice and risk management, things like who to contact in case of a bad outcome. And then stronger mentorship, supervision, and instructor quality, really speaking to avenues for supervision on forensic topics. These themes point toward practical, applied learning. Now, residents are asking for real-time discussion of forensic issues during clinical work. And so we followed up on this and got some examples. For example, applying the Involuntary Treatment Act criteria in context. So not just knowing the basics of the criteria, like danger to self or danger to others, but really looking at the law and applying it in the context of an individual patient and their circumstances. Maybe thinking about hypotheticals and how, your approach could change if the patient's clinical situation differed some. Many commented about navigating mandated reporting and doing so with their supervisors. So actually having their supervisors in the room or discussing in advance what you say when you call, for example, to make a CPS report. More discussions and planning related to capacity and safety assessments. Now, largely our residents know really strong exposure to these areas, but they identified wanting to know more about some of the practical aspects. For example, wanting to know more about how to go about talking to patients or seeking emergency risk protective orders, or learning more about firearm safety resources and having those conversations with our patients. So a key message is that forensic thinking is a part of everyday psychiatric practice, and residents are asking for more discussion on these topics. And finally, although I did not share all the survey results with you, 5 themes seem to consistently emerge from the survey, really to help us in guiding our next steps. So one, as I just mentioned, is increased attention to practical skills in routine settings. If you happen to work with learners in your forensic setting or your practical setting, think about forensic topics that do commonly present in your setting. Maybe set out some dedicated time to discuss those with your learners. We're going to look to expand structured and elective opportunities. So opportunities perhaps earlier in training, and then dedicated sites where forensic work tends to occur. Time to engage in consultation or optional activities. So, there are many opportunities outside of the structured curriculum, and some residents are looking for opportunities to participate. Several residents commented on promotion of activities that exist. So we had several respondents comment on the strengths of programming that they were able to participate in, and they thought that maybe other residents or trainees did not have that same experience, or maybe those residents didn't know about the programming. So they suggested really more efforts to promote opportunities that already exist. And then there was the theme of really reinforcing the breadth of forensic mental health. It may be surprising, but we had several people write in that they learned from the survey itself. They underappreciated how broad forensics could be. And then some commented that that really should be instilled across the curriculum. Okay, so with an understanding of the breadth of forensic mental health and recognizing that some training needs exist in our program, let's turn now to discussing the UW's Center for Mental Health Policy and the Law, really its emerging role as a hub for forensic mental health. Let me walk back a little bit with you and just talk briefly about the impetus for the center. So the impetus really started several years ago. It goes back to the state voicing an increased need for training and workforce development and research to support the behavioral needs of the citizens in Washington state. Regarding forensics, Washington state, like most states, has seen a rising volume of persons with mental illness involved in the criminal legal system. Governor Inslee announced plans to create forensic centers of excellence at one or more of the state hospitals. And you may know that forensic facilities have many of the patients most in need of high quality psychiatric services, as well as clinicians familiar with forensic services. Now, the governor's plan also included increasing the workforce of mental health professionals in the state. And regarding forensics, the supply of mental health clinicians with both aptitude and specialized forensic training really has not sufficiently increased to meet the current or projected demands. And so this led some of us at the university to think about how we could grow forensic programming, both for the university and its learners, but also in the context of the greater state need. And we had an opportunity to learn from models across the country. We interviewed training programs in forensic mental health and explored other ways that forensic programming was being advanced. And with that, we proposed a center, and it had some core activities in its mission. So let me share with you some of those core activities or mission principles. One is to advance empirically supported assessment and intervention practices. Another is to assist courts in making informed decisions by providing evaluation and consultation services. Another is to enhance law and policy by educating policymakers on behavioral health and psycholegal issues. And then to train and educate the next generation of scholars and practitioners in forensic mental health as well as others that interact with the legal system. Now, arguably, where we have had the largest impact as a center to date is with the education and training mission of the center. Now, we have been working to develop and really bolster some of the learning opportunities for clinicians in training. Those include psychiatry residents, but also for trainees in other mental health programs or other health programs in general. And so we made some changes to date to the didactics, and we're working to expand experiential learning opportunities. We provide trainings to faculty, community, and interest holders on topics related to forensic mental health. And we are hopeful to advance specialty training in the form of fellowships in forensic psychiatry or forensic research in the future. Now, let me share a little bit more about some of the education and training activities that we've been involved with. This is not a comprehensive list, but many of our activities are really open to everyone. So I want to make sure that you are aware of some of the activities that you could participate in, or at least be aware of some of the learning opportunities for our trainees as well. So we do have several rotations or clinical opportunities for general psychiatry residents. And these now really span from the R2 year through the R4 year. So more opportunities perhaps than in years past. We offer didactics that are specific to forensic topics. And for the psychiatry residents, these remain concentrated, I would say, in the R3 and R4 year, but they do now span the 4-year continuum. And in fact, residents are provided with an overview of forensic mental health early in their training. We also offer and provide forensic mental health lectures to many other training programs outside of our department, nursing, social work, and others. We have a course, PBSCI 525. This is a multidisciplinary main campus course on psychiatry and law. And the unique and helpful, I think, aspect of the course that it includes a mentored project. And Dr. Goldenberg in our department has been instrumental in keeping that and motivating others to participate in that class. We offer flagship webinar series. In fact, we have a series that we ran recently on hot topics in forensic mental health. And the most recent series was an 8-part series on civil commitment. If you're interested in series like these, all of our lectures are archived and they can be found on our center's website. We also host asynchronous learning modules on forensic topics that you again can find on our center's website. We sponsor spotlight events with national leaders to highlight their work and career paths. Oftentimes we do this in conjunction with a grand round speaker in forensic mental health. But I think it's really helpful to learn about the career trajectory and the work of some of these national leaders. We've created a forensic library. And in addition to our webinar series, we sponsor at least one annual grand rounds on a forensic mental health topic, as well as other lectures. We have a quarterly journal club, and you can find the articles, the topics, and the dates again on our center's website. And then right now we're piloting a forensic case club to look at recent legal cases and their implications for mental health. So many of these events broaden exposure, I think, to forensic mental health, but they also help us build community around this topic. Now, in creating educational programming, our center really strives to emphasize some of these core learning values. Now, we're not always perfect in this, but we really aim to recognize and acknowledge the complex nature of issues at the intersection of mental health and law, combining clinical care with ethical considerations, legal considerations, systemic issues. We really want to recognize that these issues are often complex and can be emotionally charged. We aim to have responsive content. So we select and adapt topics really based on participant requests and what we view as the emerging needs in the field. We aim to have inclusive stakeholder engagement. So we actively seek participation and viewpoints from really a broad range of interest holders. These can include health professionals, legal professionals, learners in our training programs, policymakers, advocates, individuals with lived experience, family. I think a really good example of this is our journal club. We've had several journal club sessions where there have been policymakers and members of the legal community and a judge. And the discussion is so fruitful when we're able to come together and talk about our own personal experiences and ask questions of one another. We also include social justice and equity as a focus. So we aim to integrate discussions on systemic inequalities, cultural competence, and the impact of social determinants of health. And with this, we aim to have a collaborative learning environment. So really fostering dialogue, respectful debates, knowledge sharing across all of our interest holders, with the hope of promoting an understanding and practical solutions. Now, mentorship certainly falls into the category of education and training for us. We recognize the value of mentorship within the center, not only for workforce development, but also, again, to help us build a community. And so we have built several mentorship programs. One is we have a trainee ambassadors program, and this program helps us to recognize and create opportunities for talented learners with an interest in forensic mental health or public psychiatry. We also have a Women in Forensics peer mentorship program, and this is a supportive peer community really for clinicians or learners who work in high security settings and other forensic roles. We've had 2 cohorts of this program to date, and we're currently exploring how to promote that or to expand that in the future. And then we actively pursue and try to encourage avenues for mentorship in research and scholarship in forensic mental health areas. Which brings us to another arm of our center, and that is research and policy. We really address many different types of topics within our center, at least we have to date. Many of them are complex psycholegal issues, and some use multidisciplinary and evidence-based approaches. We have been fortunate to have been able to inform the community about legislation, laws, and practices with psycholegal implications. And, as we grow the center, we hope to develop more research opportunities, really to help prepare the state to make data-driven policy. So far, we've been doing this type of work through, faculty research and scholarship, having our faculty work with learners to prepare publications and presentations. We provide expert consultation to the legislature and other organizations. And sometimes we're involved in other legal avenues, like helping to prepare amicus briefs or provide some feedback on amicus briefs that have been drafted. Now, I'm not going to share, all of the work the center has done over the past 5 years, but here is a short list of some of our featured projects to give you an example of recent activities. So Dr. Kapelovich has really taken a lead in doing some excellent clinical-based work. So research and development of care models using the cognitive behavioral therapy continuum of care and applying that to civil committees. Another example is from Dr. Michelson. She's worked with others to create some peer-reviewed online training modules in forensic topics for general psychiatry residents, and then looking at both pre and post knowledge after actually applying these training modules. I've done some work in studying the role that criminal defense attorneys could play in suicide prevention, among recently arrested defendants. And then another project has been to assess the feasibility of an academic state telehealth-only forensic mental health assessment clinic. So not only do these topics, I think, demonstrate some of the breadth of forensic mental health, but they demonstrate innovation and impact. Now, doing scholarly work in forensic mental health is really an important tool, I think, to teach forensic concepts and develop multidisciplinary research skills. It's been a priority of the center to involve learners in scholarly projects. I'm happy to say that since 2020, when our center really became a center at the end of that year, trainees have been authors with faculty in at least 26 publications. And we have had others participate in regional and national presentations. I'm not going to go through an exhaustive list, but I do want to share some of the topics that we have covered. And these topics really demonstrate the broad interest of our learners, but also expertise of the faculty. So topics include things like competency services, uh, medication noncompliance and the impact of that on the insanity defense, a university's duty to protect students from violent acts, workers' compensation for PTSD, legislative updates and how clinicians can stay abreast of legal updates that impact their practice, sexual intimacy in long-term behavioral healthcare settings, suicide prevention in carceral settings, juvenile sentencing. So this highlights, I think, how the center is emerging as a hub in training and scholarship. Now, an area that we hope to grow in the future is that of service, and service is another arm of our center. So we hope to grow in the areas of both clinical and at some point, evaluation services. We provide consultation on psycholegal issues across UW and as well as into the community. And most of these are peer-to-peer consultations. These often include consultations about forensic topics that occur in routine clinical practice. We also field consultations and requests for resources related to persons who are involved in the criminal legal system. And we have faculty, namely Dr. Kopelovich, who has worked on evidence-based practice implementation in forensic settings. I've listed here some common sources of our peer-to-peer and other consultation requests, and also top consult topics or categories. So you can see that the majority, or more than 51% of our consults currently, or in the past year, have come from university faculty and learners. But we also get a fair number of requests from individuals in the community, as well as clinicians and learners at the VA. Listed here are some of our top consult topics when we review the list of different types of consult questions we've received. And the number one is on the duty to protect. So that is the mental health clinician's duty to protect individuals in the community from the dangerous acts of our patients. I think that really highlights, we have a very complex system here in Washington. The legal standards for duty to protect are quite difficult for some to understand. So I think this highlights how forensic mental health clinicians and training can help us better bridge that gap. Other very common topics include violence risk assessment, questions about involuntary treatment, practical questions if you get contacted by the lawyers or risk management officers, things like responding to subpoenas, responding to court orders, the differences between being a fact witness and an expert witness. We field questions about professional liability and documentation, and then some questions about criminal court evaluations and what those entail. So this leads us to talk a little bit about future directions. You've let me highlight some of the center's work and accomplishments, but I want to share with you some things that we are working to develop. basically partnerships. We are expanding our collaborative approaches. And I'm excited to share that we are partnering with the law school to develop opportunities for joint law and psychiatry clinical training. In fact, in the coming academic year, we will be piloting some joint clinical training with the law school's Veterans Law Clinic, and then with my mental health and justice rotation, which is an elective rotation for psychiatry residents that's housed at the VA. We are working with the law school to develop other interprofessional learning opportunities, so ways that both law students and psychiatry or other mental health trainees can work and learn together in tandem. We hope to identify and partner with training sites to support a fellowship in forensic psychiatry for the future. And we are currently bringing together individuals with a range of expertise to develop training in legislative advocacy for psychiatrists as well as other mental health professionals. So as previously indicated, much of our programming is open to anyone, and we have some events that we already have on the calendar. So I want to share a few of these with you. Coming up in July and October, we will be having our quarterly journal club. And again, you can identify and find the topic and also the articles that have been selected by going to our website. You can also register there for the journal club. In September, we're going to kick off another of our Hot Topics webinar series. And this series is still in the development phase, but we are fortunate to have confirmed our first speaker for this series, and that will be the renowned Dr. Jeffrey Swanson. He has lots of expertise, but amongst them is outpatient assisted treatment, and so we will be talking about that. In October, we have the annual VA Forensic Mental Health Symposium. This is really geared towards multiple mental health trainees in programs at the VA and UW. And then in December, we have a mock testimony event for psychiatry residents. So psychiatry residents will be, if you will, on the hot seat as expert witnesses in a mock case that has clinical significance for mental health. And we really do welcome other learners to participate, serve as mock jurors, and learn a little bit more about the legal process. So more information about these events certainly is available through our center's newsletter, and also will be posted on our center's website. And if you're not already involved with things like our newsletter, you can sign up for it by going to the center's website. So with that, we welcome your input and involvement. We periodically distribute an outreach survey really to better understand the topics and concerns you have about forensic mental health issues. This helps us to develop and prioritize the programming. If you have not already joined our network, reach out to us to receive the newsletter and website updates. If you're able, please reach out to us and recommend any clinical sites for future resident or fellow training. And let us know if you have an interest in volunteering or engaging with the center on various committees or other activities. I'll conclude by saying that understanding the breadth of forensic mental health and having broad participation by a multitude of interest holders when discussing forensic mental health topics really are important to ensure that mental health care delivery, policy, and the law are comprehensive, evidence-based, and capable of addressing the full range of human behavior in the legal and policy contexts. So we hope that you can participate in some way. I do want to specifically highlight some thank yous. So certainly thank you to our core faculty, Dr. Sarah Kopelovich and Dr. Kate Michelson, and to our core staff, Susan Reynolds and Selena Adler. I want to thank all of our affiliate faculty and instructors, learners, and participants who have engaged in the center's programming. Thank you to all of those who have supported our programming in forensic mental health. I am so grateful for your engagement and collaboration. Really, the work is made possible by the collective dedication of our team and the support of our partners and participants. Please reach out anytime. Listed here as my email, as well as the email for our center and the center's website. I really do welcome collaboration, questions, and ideas. With that, I'll open it up to some questions if you have any.
Great. Thank you, Dr. Peel. Excellent presentation. Folks, look at that. We have about 10 minutes for Q&A. So we have a lot of people online here. So if you're at home, if you're at work, go ahead, put those questions in the Q&A box at the bottom of the screen there, and we'll try to get those answered for you in the next 10 minutes. We've got one that's been submitted earlier in the presentation. So let's just start with that one. I'll read it out loud here so everyone knows what the question is. Okay. Interesting that forensic psychiatry covers civil court systems. Given that, why aren't Washington State DCRs under the purview of the state's Office of Forensic Mental Health? These evaluations use criteria that are very different from criteria related to criminal competency.
You're right. So historically, we do have really a divide between the criminal forensic system and the civil forensic system. We typically, don't use the term forensic for things like civil commitment, although the skills and the content is forensic when you're thinking of kind of the broader context of psychiatry and the law. Our state is not unique in kind of siloing how some of our services are delivered. Our state has worked to expand really evaluations and services related to the criminal side. We had such a shortage of evaluatory services and backlogs relating to competency on trial for a while. And that's how the Office of Forensic Mental Health Services really was born to help promote and kind of lead the way in having these high quality evaluations in that sphere. I think it might be an interesting concept to have something similar on the civil side. Maybe there could be a more dedicated statewide center of evaluators, training programs related to civil. So that could be something to explore.
Yeah, great. Okay, our next question is, does your center get personal inquiries about legal issues, and how do you handle that?
We do sometimes get personal inquiries. We're not in a position to take on patients or to provide, evaluations on an individual basis at this time. So our current approach is to explain that to those who do submit an inquiry to us. And then if we happen to be aware of resources that we can direct the person to, we aim to do that.
Let's see. Okay. I'm going to move over to the chat. Yeah, we do have a question in the chat side. Okay. So thank you so much for this. I'm curious to learn how pre-med students can volunteer.
Oh, wonderful. Yes. So at times we do get inquiries from undergraduate students, early career students in health professions. And we don't always have, active opportunities, but certainly at times we do. We, for example, have a undergraduate student right now who's been extremely active in working with me on aspects of legislative advocacy. So if you go to our website, you can see summaries of some of the important bills that have been passed in recent legislative sessions within our state legislature. She worked with me to summarize many of those bills. She's doing it again this year. So activities like that, I think, are really ripe for undergraduate and pre-medical students to participate in. And we certainly welcome you to reach out to us to see if there's any active opportunities.
Yeah, so kind of a related question. You mentioned the mock testimony for psychiatry residents. So I think that sounds super interesting. So you mentioned possible opportunity for mock jurors. So two questions. How do you become a mock juror? Asking for myself. And what does that entail?
Wonderful. Yes. So, it's very difficult, I think, at times for busy clinicians to go observe court. And if you do happen to go sit in on, an open courtroom, what are the chances that you're going to find a mental health related case to be able to understand and follow? So, as part of the VA Mental Health and Justice rotation, the psychiatry residents there will get a mock case. So each year I prepare a mock file, if you will. It has a case scenario, it has pretend medical records, it has legal standards, and the psychiatry residents are tasked with writing up a forensic style report, and then they will testify. We'll have real lawyers come in and do the cross-examination of our psychiatry trainees. And we welcome others who are interested to come and participate, observe, give feedback to our learners. So we don't yet know if the testimony this December will be in person in a simulated courtroom or if it will be virtual. There's certainly benefits and cons to both, and that will get sorted out in the next month or so. But we will post it in our newsletter. And if you are interested, just sign up. We certainly welcome, people coming and participating, particularly as mock jurors and giving feedback to our learners.
Great. That sounds super interesting. I want to be a mock juror this December.
Terrific.
Okay, did we get another one here? I wanted to ask one more question since, yeah, we've got plenty of time, it looks like. One of the things you didn't have a lot of time to talk about was you talked about your project about the role of defense attorneys in suicide prevention.
Yeah.
Is there enough time here to tell us a little bit more about that project?
Sure. Yeah. So, for some criminal defendants, they may not have a lot of meaningful contact, particularly right after arrest. We know that shortly after arrest, that's actually a particularly vulnerable time, a time for increased risk of suicide. But depending on, life circumstances, connections to others, some criminal defendants may not have other connections other than their own criminal defense attorney. So, exploring that relationship, exploring what criminal defendants might, or criminal defense attorneys might see and observe could be another point of intervention for us in trying to reduce the risk of suicide, particularly amongst this vulnerable population. So we've been exploring, attitudes towards more mental health training and exposure for attorneys. We've been exploring what it is they have concerns about. Attorneys have an ethical code that is slightly different than us in mental health, and sometimes the priorities are slightly different. And so understanding how to navigate some of those within the context of helping these individuals has been really important. So we do hope to continue that work.
Right. All right. Well, it looks like our last question here is just someone is wondering if you're willing to share your email address so people can be in touch with you.
Absolutely. It was on my last slide, so if you go to the archives of this, you'll be able to see it. But it's essentially my last name, Piel, Piel, at uw.edu. Or you're welcome to reach out to the center. The center's email is just the cmphl@uw.edu.
Great. Well, then I think to conclude, I'll just add that, I was at the APA conference last week at the department's booth, and we had, I would say, more than a few young people stopping by and expressing interest in forensic psychiatry. So this was helpful for me. So now if that happens again next year, I'll be able to answer their questions a little bit better.
Perfect.
But clearly there's
Appreciate
interest
that.
out there. We had a really big audience here today. So thank you for agreeing to join us, Dr. Piel, and giving this presentation today.
My pleasure. Thanks for
Yeah,
having me.
of course. And yeah, folks at home, thank you for joining us. We've got one more Grand Rounds next week, so please join us again next Friday. Have a good weekend, everybody.